gonna push on you a little bit here. Yeah. Won't be much longer, sweetheart.
Frances Walker Leslie has been in surgery for nearly 2 hours. Doctors have pinpointed the location of the cyst in her abdomen and insert a tube to allow it to drain over the next few days.
The purpose of the drain is to continue to let the fluid drain out so that it's not building up and causing her a significant amount of pain or preventing her bowels from functioning normally.
All right, good job.
All right, thank you.
Appreciate it, you guys.
Probably get her CAT scan tomorrow.
Okay, great.
You're welcome, thank you. Have a good day. Okay, Frances, we're just gonna close the incision. We are done. She's out, huh?
She is just going to town. She's got a thumb sucker.
Oh.
The surgery over, Frances gets to hold baby Jalen for the first time. Frances is brought to the recovery room. Her ordeal is over for now. Tests will reveal the source of the cysts.
You'll be back here for about 2 hours. Okay.
The next day, Dr. Knight and her colleague evaluate the CAT scan taken just hours after Frances's C-section.
She's going to resect the spleen, right?
Exactly.
Analysis of the fluid taken from the cyst shows Frances has a rare pancreatic cyst.
You can see, compared to a kidney, we all have an idea of about how big a kidney is, that this mass is pretty large. At this point, we believe that it might be a pancreatic serous cystadenoma. That's a neoplasm or a mass, generally not a malignancy, not a malignant neoplasm, but has the potential of becoming malignant if nothing is done. Our biggest concern right now are the dilated vessels from the mass. The reason why we're concerned is because as those vessels dilate, then there's less and less wall thickness to prevent them from leaking or from breaking and from Frances bleeding to death.
This round structure in the center is her abdominal aorta, and that's the largest artery in the body that supplies the body with blood. And if we can look at all those vessels next to the aorta, we can see they're about maybe 5 or 6 times larger than the aorta. Now, mind you, those are vessels that were present in the patient, but in a normal patient, they would be almost the size of a hair. And that's what really scares us, that even without surgery, these may just rupture by their own. I strongly believe that the pregnancy was a blessing for this patient, because this was waiting to start bleeding at some point or another. I mean, and the patient is very lucky that no bleeding had occurred yet.
Meanwhile, Frances is in the postpartum unit of the hospital.
We know that the cyst is still there. We still know it's rather large. It's actually somewhere on my spleen and my pancreas. So the next process is to come back in about 3 weeks and to have it removed.
I am so thankful that Frances did not deliver vaginally. With all the straining that occurs in trying to push a baby out, I am really fearful that she would have broken a blood vessel or two and would have bled to death before I could realize what was going on. I think that ultrasound saved her life.
During the next few weeks, doctors plan to go back to the operating room, use special radiation techniques to clot the blood vessels, and remove part of Frances's pancreas. They believe she will make a full recovery.
Really, in retrospect, we realized that Frances was the proverbial time bomb, that had she not had this pregnancy and had we not had the opportunity to intervene, then those dilated blood vessels could burst and she could bleed, or this neoplasm, this growth, could proceed on to become a malignant growth. So in many ways, baby Jalen is quite the miracle.
I think we just feel like it's a miracle that she's here. It's a miracle that I'm still here considering what they found. The baby is just great. Her disposition is wonderful. She's very content. She's just precious to us.